Hello, and welcome to Identif Healthcare Solutions webinar, Interacting with Patients in a New Consumer-Based Healthcare Arena. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Identif. Before we dive into today's webinar, I wanted to take a moment to explain the process for today's presentation. First, I'd like to mention this webinar will be recorded. We'll send out a copy of the slides along with the recording within the next week. Next, for those of you who aren't familiar with Identif, I want to share a bit of who we are with you. We specialize specifically in next-gen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen, and we have a couple of next-gen add-on productivity solutions, including ChartGuard and Refund Manager. Next, I wanted to mention some upcoming webinars that on November 4th we'll be presenting on NCQA PCMH certification for Next-Gen Enterprise. Join us as we address questions and concerns of PCMH transition and annual reporting with our very own PCMH certified content expert. We want to make understanding the 2017 PCMH standards and the new Next-Gen PCMH reporting suite and the benefits of becoming a PCMH easy. So we hope that you join us in early November for that. Okay, so back to today's presentation on interacting with patients in a new consumer-based healthcare arena. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Manager of Client Development, and Alex Davis is Managing Consultant at Identif. So Lindsay, I'm going to pass it off to you. Feel free to get started when you're ready.
Great, thank you, Chelsea, and thank you everyone for joining our call today on quite a unique topic for us, dealing with patients in a new consumer-based healthcare arena. You know, as a healthcare provider or a practice manager or whatever capacity you work with your practice right now, we are in a world so enthralled in this new realm of patient consumerism. It's imperative that you're aware and mindful of how staff at your practice interact with your patients and what type of overall patient experience everyone is providing. Our goal today is to help you use the tools and resources likely already available to you to take your practice to the next level in providing the ideal patient experience and not only survive, but thrive in this new age of healthcare consumerism. Now, there's no denying patient satisfaction has become a buzzword in the healthcare industry over the last decade. In the past 10 years, practices have realized that one of the most valuable assets to their business is patient loyalty. So from this came the concept of the patient experience, which defined by the Barrel Institute is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. This concept of the ideal patient experience has long been debated over in healthcare, and many still wonder, what is the ideal patient experience? Is it each individual encounter, or is it the sum of all those interactions between the patient and the physicians? You know, some say the building blocks of this ideal experience are things like patient-centered care, a sense of connection, or courteous and caring staff, where others say that there doesn't necessarily need to be a connection with clinical staff, just efficiency and mutual respect. Now, what we do know is that patients and their loved ones can provide valuable input on what a practice is doing effectively and where they feel improvements can be made throughout the patient journey. And a positive patient experience can be shaped through creating a platform for change, leveraging that clear feedback and effective training for staff, which is the whole idea of what we're going to go over today. So right now, especially in the midst of this pandemic, healthcare is experiencing a consumer revolution. Patients were once willing to meet the healthcare system on its terms, or at least they were willing to accept those terms. Now patients are demanding that the healthcare system meet them where they are to make it more convenient and easier, on their phones, on their schedules, with as little hassle as possible. Patient satisfaction has become a high priority to practices across the country because of its impact on patient loyalty, your practice's reputation, perceptions of quality of care, employee satisfaction and retention, and the health of your practice's bottom line. So how can a patient experience program benefit your practice, not only your patients? Well, by having this in place, it's obviously going to improve patient engagement. It should enhance your physician-patient relationships. help identify areas for improvement within your practice, help recognize and celebrate what your staff does well, increase that patient loyalty we keep harping on, obviously, and what we hope for, improving patient satisfaction scores, and actually improve patient outcomes. Evidence suggests that a positive patient experience is often positively associated with best practice clinical processes, better patient safety culture, lower unnecessary utilization rates, lower hospital readmissions, and desirable clinical outcomes. So in a recent review of literature, it was actually found that in all but one of nearly 36 studies, the correlation between patient experiences and clinical care quality was positive or non-significant. So if you're not convinced, it's likely because you're like me and you're a numbers person. So let's take a look at these stats. A happy customer will tell 3 to 4 people about their experience, but an unhappy one will tell 9 to 15 about their bad experience. 13% of those unhappy customers will tell more than 20 people. I don't know if you're anything like me or my family, but that 100% holds true. 81% of people are more likely to work with an organization again after a good customer service experience. 91% of unhappy customers will never willingly do business with your organization again. It can take around 12 good experiences to make up for one bad one. And companies or practices who make customer service a priority make 60% higher profits than their rivals. And it can actually be 7 times more expensive to get a new customer or patient than it is to keep a current one. Now, you might be saying, these all say customer, not patients, or company, not practices. Healthcare is totally different, but it's not. And that's the point. Healthcare has been hit hard and fast by the shift to consumerism. Your patients are no longer just your patients. They are your customers. They are your walking advertisers and your brand representatives, and there's no going back. There's no reversing this. These numbers now apply to healthcare and can truly make or break your practice's future. So here's the million-dollar question. How can your practice measure patient experience? So to measure this and get a complete picture, you need to get both qualitative and quantitative feedback from multiple sources. These tools are what we're going to actually be talking about today, and they include CAHPS, patient surveys, PFAC or Patient and Family Advisory Council, rounding data, consistency in patient communication, looking at different scripts and tools, as well as social media and other online reputation platforms. So let's break each one of those down and briefly review how you can leverage these tools in your practice. First off being CAHPS. So CAHPS stands for Consumer Assessment of Healthcare Providers and Systems. Notice anything in that title that stands out? Not only because I highlighted it, but because even from the creation of this industry standard assessment, there is recognition there that patients are being viewed as consumers and that they're acting as such. So the CAHPS survey asks consumers, aka patients, to report on their experiences with healthcare services all across different settings. The surveys are a product of the Agency for Healthcare Research and Quality's CAHPS program, or the AHRQ, which is a public-private initiative to develop and maintain standardized surveys of patient experiences within ambulatory and facility level care. So the purpose of AHRQ's CAHPS program really is to advance scientific understanding of the patient experience within healthcare. So learning from other consumer-focused industries, the AHRQ and others really wanted to develop a comprehensive voice of their customer through these surveys. They believed it was best to do so by bringing in multiple sources of feedback to get well-rounded and usable data. This helps an organization see, how you're doing and know what changes that need to take place in order to improve. So CAHPS surveys ask patients, and sometimes their family or caregivers, to report on their experiences with a range of different healthcare services at different levels of the delivery system. Some may ask about relationships with providers or medical groups or about care for specific health conditions. These surveys focus on areas that patients themselves have said are important to them. So users of CAHPS surveys may take different approaches to analyze their data to generate results that can be reported to healthcare providers, your own internal administration, or even your consumers. So we know while patients may not be the most knowledgeable informants about the technical quality of their care, They are the most knowledgeable about their experiences with that care. In addition, the aspects of the patient experience addressed by the CAP surveys represent areas that both patients and providers have indicated are qualities of a good provider visit. So these areas include communication between providers and patients, accessibility and timeliness of care, and of course, staff courtesy and respect. So all CAP surveys go through a similar development process that involves multiple steps, as you can clearly see. This process is designed to gather and apply input from patients, families, and stakeholders to ensure the reliability and usefulness of the CAP's patient experience measures. So if you are interested in implementing this in your practice, from a very high level overview, the survey is actually administered through a mixed mode data collection protocol, which includes a pre-notification letter, 2 survey mailings, and then up to 6 follow-up phone calls to patients who might not have returned that survey by mail. There is actually a list of approved vendors to distribute these CAP surveys. If you want to use CAPs, you actually can contract with them. An example is Press-Ganey. And then that chosen vendor actually takes care of administering that survey and organizing the raw data for you. Now, there are several benefits to using CAP surveys. First, CAP surveys reflect years of research with patients and families to determine how they define quality experiences and how to best ask patients about critical aspects of their healthcare experience. Second, CAP surveys are available to everyone at no charge from the AHRQ. And finally, because these surveys are standardized, healthcare organizations can actually use the results to compare and assess their performance in relation to similar organizations, pinpoint strengths and weaknesses in patient experiences, actually evaluate the effectiveness of interventions to improve specific areas of the patient experience. And when the survey results are reported, healthcare consumers and purchasers can use the information to compare and evaluate performance of health plans, hospitals, and providers across the entire continuum of care and make informed choices. Not to mention, you can use these results as credit for many quality reporting programs, hint, hint, MIPS, and in different value-based contract negotiations with your payers as well. Now, with the same idea in mind, but taking a step back, let's look at patient surveys in general. I know it's not a reasonable expectation to think every practice or everyone on this call is going to be able to implement CAPs, but everyone can do some sort of patient feedback. But why do we need this feedback from patients? Why is this so critical to success in this new consumer-driven market? Well, according to patient satisfaction measurement firm, again, Press-Ganey, positive patient experience outperforms traditional marketing tools when it comes to building patient loyalty. They've actually found patients are 5 times more likely to select a practice because they had a positive experience there than if the practice had any sort of consumer marketing protocol. This idea of loyalty, has always been, I would call it an elusive kind of holy grail in healthcare of how to get your patients to keep coming back. Practices want patients who will continue seeing their providers in that specific system or practice. There are obviously financial benefits to patient loyalty, as your organization or practice are fighting for patients' business in this increasingly competitive market. But there are also benefits to the patient's care, which is the priority here. Less things are slipping through the cracks, creating gaps in care, and overall care coordination improves. So what should you cover in your patient surveys if you were able to deploy these? So some of the most commonly used topics to center questions around include wait times, waiting room and procedure room environments and cleanliness, thoroughness of medical exams, patient-physician communication and interaction, that's a big one, staff courtesy and compassion, the actual ease of getting an appointment as well as referrals, billing procedures and personnel, facility access and, believe it or not, parking, as well as any desired new services. We also encourage our clients to think about asking your patients a very simple but effective question, and that's what matters to you. This question starts the conversation about what patients prefer and value in their care and deepens the connection between the patient and your providers. So the Institute for Healthcare Improvement has actually embraced this question as the foundation of developing genuine partnerships for co-creating health. Co-creating health, in my mind, is just another way of shared decision making, which is an approach that I think is intrinsic to person-centered care, and it's grounded in trusting communication between patients and their care team, often, with the involvement of their families as well. So with this approach, clinicians and patients work together to make care decisions, weighing the best available clinical evidence about options, the balance between risk and benefits, and the patient's preferences and values as well. Now, I do feel it necessary to call out a very important distinction when it comes to these surveys. Experience is not the same as satisfaction. Patient experience surveys focus on how patients experience or perceived key parts of their care, not how satisfied they were with their care. And keep in mind, satisfied patients don't always equal a returning customer. In this competitive healthcare market, patients, often need to be truly impressed to be loyal. So we know patients consider two things in determining their loyalty to a healthcare provider. One is technical skill, which I would dare say is expected, that they can treat you. Two is actually excellent customer satisfaction or service. That's the big wow factor. To many patients, excellent experience happens when their expectations are exceeded, not when they're met. So what these surveys can provide your practice, besides the most important aspect, which is feedback to make sure you're providing the best possible care for your patients and learning if you're meeting expectations or lacking, they can also improve your patient loyalty, increase referrals, give you leverage when negotiating with healthcare networks or plans, act as a benchmark for goal setting, and also help your organization attain certain accreditations. I mentioned, those quality reporting programs or certain certifications as well. But they also let your patients know that you care about high quality care and that you are proactively searching for ways you can provide them with better services. These surveys really empower patients while presenting your organization with honest and hopefully insightful feedback you can interpret and actually act upon to make change. So the next tool we're actually going to discuss is called the PFAC, or Patient and Family Advisory Council. And I'm actually going to go ahead and let Alex take it from here. So Alex, it is all yours for this section.
Thank you, Lindsay. Many of you have probably heard of a Patient and Family Advisory Council before. And what that is it's made up of patients and family members who have probably received care directly or been caregivers at the organization that they want to represent. They're usually also accompanied by administrators, providers that work in that area, and other staff, such as practice managers or nurse management. It provides a tool for your group to seek and learn from patients and their families and their perspectives. And you can also promote patient and family-centered care with an organization. It gives a voice to those who have experienced the continuum of your care and what your practice has to offer. Ultimately, patient and family advisory councils are really about reducing anxiety and suffering and forming strong relationships with your patients. It creates those conversations that help you understand their perceptions. There are also benefits for not only your healthcare organization, but also patients and their families as well. So your patients can often benefit from a patient and family advisory council. So it provides an effective tool for receiving and responding to patient input that you receive through the advisory council. It can also increase understanding between patients and their caregivers and the staff that take care of them. It just creates an opportunity for everyone to really just be on more of the same page. You can also transform a culture towards a patient-centered care. And this allows you to develop programs and policies that are relevant to the patients and families that you serve, and who better give you an understanding of ideas about this than patients that have been coming to your practice for months or years that you've seen. For practices seeking to become patient-centered medical homes, a patient and family advisory council can also be essential. It benefits your patients in a few ways. They appreciate being listened to and having their opinions valued. They can become advocates for patient and family-centered care and healthcare in their community and give them like a greater purpose for that. It helps them understand to become an active participant in their own care by helping give them opportunities to learn about what the practice is all about. It can also develop close relationships with other members of the council, patients and staff alike. And when you do that, outcomes typically improve. It is not enough to just write a treatment plan, but you can make sure the patient and family are fully engaged and on the same page. And through this feedback from patients is how you can do so. You have to understand what the patients really care about and what their values are and what their needs really are. There are a few steps that can be taken in order to create a successful patient and family advisory council. The first step is really ensuring that a practice leadership support is there, and you can select a sponsor. So a sponsor is typically somebody that is a leader in the organization. It might involve stakeholders who can be involved with the efforts and to ensure like buy-in from other staff. And at minimum, you can support. You need support from department supervisors, managers, department heads, and physician leadership is extremely important. A successful sponsor or stakeholder that I've seen in the past personally has been like a director of volunteer services for a major cancer center. Many of the volunteers were past patients, and this individual had very good rapport with both leadership and current and past patients to help gain that buy-in. So step 2 would be creating a PVAC planning and launch plan. So this could be comprised of a small team to manage the launch of your patient and family advisory council. So the primary duties of this planning and launch team could be to create and implement a recruitment plan, design the PVAC structure, and think of if there is a budget involved with it to help get that organized as well. So designing that structure, this could mean assigning specific roles. And it's important to keep in mind that most patient family advisory councils, especially with clinics in the ambulatory setting, are usually comprised of 12 members and 1 chairperson. So your recruitment plan. Outreach to the community through emails, messages, or patient portal. You can utilize those tools that help keep you connected with your patients. Also, the practice's monthly emails, if you have that, or your company's website. Holding a town hall type of event to invite questions for the potential advisors as well. And if you do need to develop that initial budget, it's important to keep track of logos, promotional products that might be involved, letters to thank and appreciate from the organization itself, and what is involved in the meetings that you might have and hold like monthly. There should also be a patient and family advisory council champion, and that's typically a physician leader who values family professional partnerships, and then also a PVAC liaison who is a staff member that helps understand those patient and family professional partnerships. Once you have the buy-in from leadership and you've created your plan and structure for recruitment, our step 3 is to invite, interview, and select a diverse group of people and members to be involved in our patient and family advisory council. There are many types of diversity, and this could include gender, race, culture, heritage, language, socioeconomic status, disease and disability, and family structure. And it's important to keep all of those in mind. Step 3 is the actual launch and support of your patient and family advisory council. There are essential skills and development for family advisory counselors in practice. So making sure there's an environment for storytelling and own experiences, and this will probably come from your patients and families. Self-awareness and indication to appreciate diversity and differences. Deep listening and respectful conversations, and then bringing yourselves together for conflict resolution and cultural competency. And then finally, to sustain and evaluate and improve once you have things off the ground. So a successful PVAC is more than just bringing people together. You need to make sure it's going to last. Involving PVAC members in your evaluations, you can incorporate their feedback into the work that you do, which can foster an engaging and rewarding partnerships. With time and attention, even the most informal feedback interactions between patients and families and practices can evolve into authentic partnerships. Another way to create patient-centered care center is to do active rounding in your wait rooms and clinics. So patient rounding can help practices be proactive to their patients' needs instead of waiting around to be reactive to something that might end up blow up in the long run. Yes, we hear this being done in hospital settings, but more and more we're hearing about rounding being done in outpatient settings. Rounding has been shown to increase patient satisfaction with their clinical experience as a result of regular attention from staff. For hospital and outpatient clinics across the country, rounding can be a vital and complex process. In an outpatient setting, your practice can round on patients after they're in rooms, and this can help inform them of wait times while they're in there. It's important to also make sure you're managing up physicians and other staff. So what this does is it really serves as a transfer of trust. So if a patient is very comfortable with a nurse and then they talk up the physician that's about to come into the room, it transfers that trust to the physician automatically. And this can be done, this rounding while the patient's in a room, by nursing leadership, practice managers, or really any staff that is trained to complete this rounding. Another method for rounding can be actually in your waiting rooms or reception areas. And you can ask patients how they're doing while they're in there. This offers touch points with the patient. You can offer them things like coffee, water, entertainment items such as books or magazines, but it helps them know that you care if they're out there in the waiting area. Rounding on patients is a great way to capture what's working well, but it also gives you insight into help you see what needs to be improved, straight from the patient's mouth. So this is an example of what rounding questions and a spreadsheet can look like. So you don't have to have a fancy rounding software to keep track of this. Many practices can document and store this rounding information, even by just a developed Excel or Sheets document. It helps their practice keep track of trends, like hot topics that are specific to wait times, cleanliness, courtesy of staff, communication and education from clinical staff, and really what is most important for you to track for your clinic or ambulatory site. Consistency in patient communication is key, and this can start with new hire training, and often it is. Multiple studies have shown that relationship-centered communication skills can be improved with effective training, and that effective communication improves medical outcomes, safety, patient adherence, patient satisfaction, and clinical satisfaction and efficiency. R.E.D.E is one of the tools that you can train your staffs on for communication. So it helps establish powerful communication framework to use with their patients, families, and even teammates. It can be used each and every time you're entering a patient's room, inpatient or outpatient, to reduce patients' anxiety and help build confidence in the staff skills and abilities. It will also show the patients and their loved ones that your staff really care. So R.E.D.E is broken down into 5 different steps: acknowledge, introduce, duration, explanation, and thank. So acknowledge. This is creating a positive and lasting first impression. It greets patients, families, and caregivers and colleagues with a smile, uses their name if you know them. It's really an introduction. But this does lead into the introduction. So you're introducing yourself and your role in a polite and friendly manner. Tell them who you are, your role, and what they can expect from you, so they better understand what you're there to do for them. Next, we're going to talk about duration. You can set expectations with patients regarding the amount of time the visit might take, and it keeps patients updated, especially in situations where there might be wait times, as in clinics. Explanation. Clearly explain to the patient what to expect during their visit. For example, how a procedure works, who will be involved in the visit, whether that's nurses, residents, pharmacists that will be involved not just outside of an MA and physician care, and who they will be in contact with if they need assistance and how they do so. Make it a point to ask if there's anything else you can do for them. This goes a long way with the explanation. And last but not least, thank you. Be sure to thank them for being there, whether it's the patient or a colleague for their help too. Build a culture of gratitude that can improve the experience for all involved. The R.E.D.E to communicate model was created by the Cleveland Clinic as a training program for providers and other clinical staff as framework for effective communication in the provider-patient relationship. This is very similar to R.E.D.E. It just elaborates just a little bit more on how to create that lasting impression for the patient. Ensuring effective provider-patient communication is the right thing to do for your patients. And of course, there's no 100% correct formula for communicating with patients. It's important to understand that this is not a one-size-fits-all method, just a suggestion. In today's healthcare environment, it's common for providers to face challenges, including limited time for patients and their interactions, increased medical complexities, and competing expectations that the patients might have. To meet these challenges, the R.E.D.E communicate model includes advanced topics that your practices can explore to deal with distinct challenges that they might have in their workforce, such as communicating with patients who might have high pain levels, delivering bad news and outcomes that professionals might not be comfortable with, and maximizing health outcomes through motivational interviewing. So this model has a checklist that can be broken down into 3 different phases. Phase 1 is where you're going to establish the relationship itself. Creating a safe and supportive atmosphere is essential for making personal connection. Fostering trust and collaboration, conveying value and respect with the welcome and first impression. And in doing this, we are essentially building an emotion bank account that our patients and families can pull out of. Phase 2, developing the relationship through active listening and truly understanding the patient's expectations. And then there's also this 3rd column here, and this is where you're going to engage what happens through true collaboration. And it's important that the patient actually understands the plan of care. This can be done through using open-ended questions, reflecting on the patient's meaning and emotions to the things that you're saying. Often when a patient is hearing a diagnosis for the first time, they're not really truly processing it, so keeping that in mind. Informing the best that you can, and assess patient understanding and emotions reactions to the information that's provided. So this is a grid here, and there are examples in the chart here for each phase, and we're going to break that down just a little bit. So phase 1 starts with a knock and asking permission to come into their space. Introduction and smile as well after this. So many times when a patient is coming into a clinic setting, they're not there because they're going on vacation. They're there for a reason that they feel is out of their control. So giving them the option to even invite you into their room gives a little bit of that control back. Being collaborative and using open-ended questions about care and asking what else makes them seem that this experience is a shared one. Another thing to take note of is body language and nonverbal cues. One example of this is sitting at eye level with your patients. There's a study out there that has proved that sitting and being at eye level with your patients actually gives the patient the perception that you spent twice as long with them in clinic than if you stood over them and just talked over them. Phase 2. It's all about reflective listening and using continual phrases like, what I hear you saying. So these show that you are actively listening and that you can regurgitate back to them that you understood what they were trying to convey. Phase 3 is about the sharing of information and plan, and this is done through clearly describing the diagnosis and patient education, and checking for mutual understanding and development of the plan, and then providing positive closure.
Great. Well, thank you, Alex. So we're going to go ahead and move on and actually talk about our last we'll call it a tool, one of the aspects of this entire patient experience process that has become extremely relevant lately, and that is social media and online reputation platforms. So in this technology-driven world, it's important for healthcare organizations to react to their customers' needs and preferences in order to actually successfully compete in this, like I said, competitive new marketplace. That actually includes their desire for you to have an online presence these days, especially now in COVID times. With the large increase in virtual interactions, this is becoming crucial. So a recent Google study found of 20 different medical and dental practices found 77% of patients use search engines before booking an appointment. 83% of patients browsed practice websites to learn more before booking. 50% of patients used health information sites to research various practices, and 26% of patients relied on consumer-generated reviews to influence their decisions. I don't think these numbers are shocking to anyone because if you're like me, I've done all of these things when selecting my own PCP, which kind of solidifies this. These numbers can't be ignored. Patients are adapting and taking on characteristics of a consumer more and more in this healthcare arena. Right now, online reviews and rating sites have the highest public visibility into provider reputation. At least 1 in 3 prospective patients who viewed online sites sought out or avoided physicians based on those ratings. An internet-based survey of adults published actually in the Journal of the American Medical Association also revealed that retail-like expectations of buyers are becoming more and more prevalent, and patients are increasingly turning to online physician ratings just as they have sought ratings for other products and services. It's actually Amazon Prime Day today, so perfect example. I don't think any of us goes on Amazon right now and purchases something without reading at least a few of those reviews. That is, I would say slowly but surely, but it's not even slow anymore. This is absolutely saturating the healthcare industry right now. Patients aren't just looking for reviews out there in cyberspace, they're also contributing their own thoughts and experiences as well. Now, this trend toward patient use of online reviews is driven by a number of factors, including increasing digital connectivity, heightened demand for consumers, many of whom are shouldering higher and higher portions of their healthcare spending. So they're seeking out the best care at the most affordable price. Government programs now are emphasizing patient feedback when they're awarding payments and bonuses to healthcare providers, and increased emphasis on online reviews from healthcare practitioners themselves. Some health centers actually provide incentives for online patient ratings, and doctors are more and more likely to read their own ratings. They want to know what's being said about them right now. Now, evaluations are typically presented as numerical ratings assigned to a variety of factors influencing patient care. The specific factors including, in each rating varies by site for sure and survey, but the most common categories we've seen include, first and foremost, an overall rating, usually a star rating of some sort. And then breaking that down, you have usually the physician's communication skills or bedside manner, availability of appointments. So think of the ease of scheduling, your wait time, or even, your hold time on the phone if it wasn't through an online booking. Facilities, so think of your office cleanliness as well as your waiting room accommodations. And then, of course, your staff's courtesy and professionalism. So this should sound pretty familiar with what we covered on what to focus on for your own patient surveys as well. So there is a lot of overlap here. So, what this all means, looking at your online presence and really what to focus on is that, in this World Wide Web, it's a great opportunity to market your practice and increase visibility, but could also be detrimental to your business if patients aren't happy with their care. So providers, it's time to be proactive and start paying attention to what's circulating on the internet regarding your practice. And it's important to realize just how many different places these reviews could be hiding besides just your practice website. So if we look at the next slide here, we'll see all the different outlets that we have available. You have social media, primarily Facebook, LinkedIn, even Twitter YouTube, and blogs now. The key to success here is really keeping your material fresh and engaging. Physician rating and review sites. Compile a list internally and check that list regularly of your online listings. A 2011 study of online physician rating sites identified these 10 as the most commonly visited sites. Again, a little bit out of date, but I think still pretty relevant looking at the list that we see that have the most up-to-date and the largest amount of user-generated content. So I think we've all probably logged on to HealthGrades at some point. For sure, I could see that staying as number one, but also vitals.com, even ZocDoc now in that marketplace, has reviews as well. R.E.D.E, Yelp even has providers on it right now. So a lot of options for patients and a lot of avenues for them to look. Even Google reviews are really big right now as well. But last and of course not least either are search engine results. You want to use a variety of keywords and search with, Google is obviously the top hitter here, but also use Bing or Yahoo and others that your practice can think of, and pay particular attention to what is or what isn't coming up, or what words you can or can't use to bring your practice up, and how that might need to change your website or your marketing moving forward. So why is this so important? Well, to sum it up pretty nicely in 3 bullets, I would say your prospective patients are online, your current patients are online, and your competitors are online. If you do not control your brand online, someone else will. You need to be aware of what's out there and what's being said about you and what's being talked about. The bottom line is that more than ever, physician ratings significantly influence the process of attracting new patients to your front door and keeping them there. So, here are iTentive's quick kind of tips and tricks to managing your online reputation. As a provider, the one thing I will stress, never respond to a positive or negative comment, as it could actually be a compliance issue, just even acknowledging that they were a patient of yours. So whether it be good or bad, as a provider, stay away from that kind of realm here. I would recommend having a team in place internally to handle that. Have a triaging system in place for these reviews with someone regularly checking them. Have a policy in place for how office staff, or like I said, someone similarly removed from the patient treatment should respond to reviews, both good and bad. Don't be afraid to use poor reviews as helpful feedback that could actually improve your practice. You're taking this survey data, you'd hope at some point, and doing the same thing. Use those reviews and put those to good use. And lastly, be aware that online reviews exist and acknowledge they aren't going away. This isn't something you can ignore, close your eyes and cross your fingers that it'll disappear one day. These are here and they're here to stay, and they're only increasing in popularity and in usefulness by your patients. We know at iTentive maintaining a positive digital image can definitely be challenging, and especially new right now, especially as social media and online review websites are becoming truly, I would say, formative players in healthcare. However, if it is well managed and it's not ignored, reviews can actually spark improvement and lead to a more transparent provider-patient relationship that fosters patient engagement and a positive patient experience. Because let's be honest here, I think it's safe to say a positive patient experience, which, isn't just the focus for everything we've talked about today, but it's also the key to a good review and what we're striving for with all of these tools put in place. So if you are a next-gen user, how can you leverage these tools, most likely already available to you, to implement these and ensure a positive patient experience? So we did keep this next-gen section towards the end. So if you are not a next-gen user, you can get some exposure, and I'm sure you can find correlations to whatever system you are using. But if you are a next-gen user, we're going to talk about the patient experience platform here just a little bit. So I will turn it back over to Alex to look at how next-gen's patient experience platform can actually support your practice to accomplish these goals.
Thank you, Lindsay. We have discussed about patient-centered care and adding to the patient experience. So we know it's important during this new consumer-based healthcare time to do so. So there are new technologies that are out, like Patient Portal, telehealth apps, especially prevalent with the pandemic times that we are seeing, self-scheduling that is new to patients, and even smart hospital and clinic rooms that contribute to the creation and cutting-edge technologies that add to patient-provider relationships. So now more than ever, it's important to understand how we can use these tools, even while new ones are being created, to strengthen that special healing and trusting relationship at the core of what providers are doing. So more than ever, patients really want access to their care in a convenient way. They want to feel empowered to take charge of their own health, and they want the tools to do so. Providers, on the other hand, they need a way to engage with their patients with streamlined workflows and really free up staff time to be able to take care of more patients. So NextGen's patient experience platform, that's also known as PXP, is a suite that is patient-facing applications designed to help patients connect and interact with their healthcare ecosystem. This product can help your practice stay connected to its patients while increasing efficiency and patient engagement. So as you can see in this chart here, the PXP product is broken down into a few different subcategories. So visit management, that's going to be NextGen's patient self-scheduling, and this is going to include reminders and notifications that are surrounding the appointments that have been scheduled. Next, we have pre-visit. So that's going to be where your pre-check solution happens. So where patients can update demographics, insurance information, and fill out any patient forms that might need to be done before the patient actually is seen by the provider in clinic. The visit. Yes, we have in-office visits, but now more than ever, we are seeing virtual visits. So NextGen offers virtual visits as a solution for that. Post-visit. So this is where patients can pay online prior, they can pay now, and they can also use a virtual card swiper. And then lastly, health management. So patients can request prescription refill requests, secure messaging between them and their provider. They can review health records that is in their chart, and then any other type of messaging that needs to be done with nurse and other staff as well. So we'll go back to the visit management. Online appointment scheduling increases patient satisfaction and revenue for your practice while reducing phone volumes and no-shows. Patients can click on the appointment icon within the PXP product. Then they can type in their demographic information, select the provider that they want to see within the practice, and choose whether the visit is going to be done in visit, or in office, or virtually. The next section is pre-visit. So this is broken down into pre-check and NextGen Pay. So pre-check pulls the upcoming appointments from the PM system and shows staff which pre-check tasks are or are not completed. So patients will get an email or text reminder with the link to complete their pre-check or their pre-appointment information, so they can add and update demographics, that insurance information we were talking about, complete patient registration forms, all before the appointment time happens. This all actually flows back into the EHR and PM systems, and this allows for the front desk and other office staff to work more on patient-centric tasks and add to a greater patient experience. Patient payments offer multiple ways for the patients to pay their bills, such as guest payment through their website or through the patient portal and more. Patients can pay their copay all before even stepping foot into the office. Next, we have NextGen visits, so virtual visits. So we offer integrated virtual visits, ensuring that a smooth user experience is tailored to the workflow of the organization. So you schedule the virtual visit in your practice management system as you would just as a regular in-office visit, using your designated virtual visit event type, and the appointment flows through into the platform. Virtual visit platform sends automatically generated appointment reminder emails and text messages, SMSs, notifications to the scheduled patient. And this helps to lower the amount of no-shows and salvage otherwise lost visit revenue. These reminders can also be customized for the practice and not just a one-fits-all size reminder. When it's time for the visit, your patient can join by clicking a link that's going to be sent to them through their email or phone number through a text message on file in NextGen. So as a provider, you will join the visit after logging into the NextGen virtual visit website. You then will conduct your virtual visit, and when you're finished, we'll send the virtual visit sends basic information about the encounter back into the patient's chart through NextGen, and you can rack up your documentation and billing as you normally would. The platform also provides HIPAA compliant and secure HD video on the platform and is offered in both English and Spanish at this time. So patients are looking to make it more convenient to speak with their doctor for minor office visits and urgent care needs. Patients complete intake questions and provide consent for that visit. And after the visit, the patient receives a questionnaire. We were talking about surveys. So within this product, you're actually able to collect that patient feedback on how they rated this experience. This helps offices conduct patient appointments with video experiences from the provider, and the providers can do it at home or in office while serving the needs of their patient. Post-visit. So this is broken down into NextGen Measure. So NextGen Measure is a patient experience and clinical outcomes platform, which enables you to collect and interpret and act on that patient feedback that we were talking about on the slide prior. So this helps to enhance patient care and makes the patients feel like you're really being engaging with them. And so in turn, this builds in your business and loyal patients. So the NextGen portal functions, it's also a part of the PXP. So the patient portal allows for patients to conduct routine tasks online while automatically workflows for your practice. The portal allows for patients to view their medical records, and they automatically get test results sent to them. Patients can get questions answered before their appointment through the patient portal if they choose to have questions followed up on prior to even coming in for the appointment. And this does eliminate phone tag and increase patients' likelihood of being updated and engaged by the practice.
Okay, well, thank you. Thank you, Lindsay and Alex. I really appreciate that. One comment that I wanted to make before we jump into the attentive next steps is that we obviously designed this on the basis of the proven steps and the things that we've experienced. COVID does change some of those things. For example, you won't be handing out magazines in the waiting room, or you won't be providing coffee. However, those days will get past us, and even in COVID, we can substitute some of those steps with other steps. If you've got patients waiting in the parking lot, perhaps you know, a little card to Starbucks or something if there's one there, or they're running behind. Just some thoughts as to how to adapt, because most of this still applies, but there are a few things that I did want to acknowledge that COVID probably doesn't make them quite valid today, but the concept is still very much the same. So as we move on to next steps, if you're uncertain where your practice stands, let Attentive help. We can assess your current readiness, provide recommendations, and help you implement new processes and procedures. I'd also be interested in those of you who attended this webinar. This is a bit different for us. If you'd be interested in these type of services, perhaps helping you develop some of these other programs that move a little bit beyond just the NextGen sphere, and maybe take into consideration some of the new and inventive ways that we're working through the changes that are going on in healthcare today. You can visit us at attentive.com. You can sign up for our informative webinars and blogs. Consider our 3-day fixed price on-site consultations. We do those for clinical workflow, revenue cycle and front office procedures, technology and performance. So please take a look at those if you have an interest. And then you can always test drive one of our products. So if you have any questions on the presentation today, please feel free to reach out to Alex or Lindsay. I'm sure they'll be able to tell you and help you with some of the reference material and let you know a little bit more about how we developed all of this information. But right now, we'll open it up for questions if we have any.
Perfect. Thank you so much, Cindy. Again, if you have questions, you can type them in the questions area of the webinar control panel. And Alex, would you mind flipping back to the contact information screen 2 slides back, if you would? And we'll just leave that up while people are typing their questions, just in case they have questions that occur to them after the fact. You can always see the information up on the screen. Basically, any way that you can get a hold of us, please don't hesitate to reach out to us, whether you email Lindsay or Alex or reply back to the email that I'll be sending out with the link to the slides and recording. Any way you can get a hold of us, we're happy to help, so don't hesitate. It looks like we have 2 questions right now, so if you have them, we'll have plenty of time to answer them. And if you don't, then that just means hopefully that we did a really great and thorough job of making this presentation. Okay, so first question. 1, hi, I'm a patient experience manager for my practice. I just wanted to say what a great webinar. And 2, in regards to patient surveys, what questions do you see asked the most or are most helpful for your clients to make changes?
I can grab that one, Chelsea, and thank you. Thank you so much for attending. We appreciate the feedback. But we recommend covering topics like wait times. Again, like Cindy had mentioned, covering topics like the waiting rooms or cleanliness or your overall experience in the practice, especially during COVID right now, might not apply. You might want to consider, actually removing those off your surveys if you're still handing those out right now. But wait times or like appointment accessibility or asking questions, surrounding that, meaning, are you interested in online scheduling if you don't have that already implemented? So kind of focusing on, accessibility. Then we also recommend focusing on the patient-physician communication and interactions. A few questions maybe about those. Did you feel that, you got all the information you needed today? Did you understand it? Things like that. Staff courtesy and compassion, the rest of the clinical care team, as well as the front office, asking about their professionalism, their compassion, their courtesy as well. As well as, I always like to say desired new services too, but kind of the big thing I would focus on that I think I mentioned that's really going to give your practice the best results and actually actionable data is when you ask questions that are open-ended versus yes or no in these surveys. So, if you're going to ask a yes or no question, you're not getting anything else from that. If you provide a very open-ended question, not only are you getting, unstructured data, but you're getting those comments and you're letting your patients know that you value their feedback. And typically those are where true insightful, findings come from and actually prompt your practice on how to change. So that would be my biggest recommendation would be if you can, steer away from those simple yes or no questions, or if you are going to do, a rating type question like 1 to 5, leave a place for them to write their comments or additional feedback as well.
Great, thank you, Lindsay. Next question. Sorry about that. Is anybody in an outpatient setting currently using patient satisfaction rounding?
I can answer that one, Chelsea. I think in the outpatient setting, you're seeing more of rounding not only being done while the patient's in a room, but out in the wait rooms. I know a lot of ambulatory centers care about wait times, and they want to know which one of their clinics may be having maybe having difficulty keeping on track as far as appointment times. So it also helps you keep in touch with your patients and letting them know that you care and that you are proactively trying to help them understand why the wait times might be the way that they are for the day. And you can also let them know that the doctor spent a lot of time with a previous patient and they're going to do just the same for them. Now, while the patient's back in a room, that proactive rounding can be done to gain similar information that Lindsay was talking about as far as provider communications, the cleanliness of the room, if they feel that they're ready to be discharged from that appointment, if they understand their medications and the protocol for their care and treatment moving forward.
Perfect, thank you, Alex. And next question. When are you finding clients are moving to the new patient portal? Cindy, you want to answer that one?
Yes, basically it's kind of a slow process. I don't think they're moving as quickly as NextGen had hoped. Obviously, with the new release coming out next year, the existing portal will not work in that release. So I think some of them are measuring as to when they're going to go with the what they're calling the Phoenix release or the 2021 the latest name, but it's going to change. So, so don't quote me on that name. At any rate, once the existing portal will not work then. You're not going to be forced to move to it for several years unless you go to that upgrade. That upgrade is going to be the catalyst. So you've got to move to it either with that upgrade or prior to going to that upgrade. And I think with some of the integration and things, they're working really hard to get people moving, but I don't think it's going as quickly as they want. I can tell you right now, the clients we work directly with, I've got a couple that are signing, and I've had a couple that were on it prior to the MedFusion NextGen acquisition. So basically, I've had one move, one that was already on it, and I have another that is getting ready to move to it. So those are the ones that I've had personal experience with.
Great, thank you, Cindy. And it looks like that's all the questions for the day, and it looks like we're at the end of our time anyways, so that works perfectly. So thank you again, everybody, for joining us today. I know that everyone's schedules are really busy right now, so we appreciate you taking the time out of your day to join us. If you have follow-up questions, like I said, don't hesitate to let us know. We're happy to help, and we hope to see you in early November for our next educational webinar, and before that at UGM. Virtual UGM. We hope to virtually see you at virtual UGM this year. So thank you,
Goodbye,
everybody.
Thank you.